for would be advised to ring 111 to try and get some help via that particular channel. Is that, have I understood that right, Joe?
If the child has got urgent dental care and dental needs, they have swelling or signs of infection, they're in pain, then and they cannot contact a general dental practice, then they should contact NHS 111, get the initial acute situation addressed. It may be that the appointment might not be made available in the Wakefield service, and may have to travel as far as Huddersfield or Leeds. Back when this system started, people were having to travel to Grimsby. But again, this is another issue that I have as an LDC chair with the provision of urgent dental care across Yorkshire and the Humber. But yeah, if they're having urgent needs and they can't contact a dental practice, get it addressed, contact NHS 111. There are practices who are taking on patients from time to time, and it is a very difficult, arduous, or can be a very difficult and stressful thing to have to ring around a number of dental practices to get in. But there are some that are accepting patients from time to time as capacity allows. Now, over the last 12 months, it's been much more difficult to get routine dentistry from a practice because obviously we've been closed and we're working to very restricted circumstances. But there has been an agreement, certainly up until the end of March, that all dental practices should see patients who have urgent dental care needs, whether or not they're patients of that practice or not. Now, as these targets have been introduced, which they were in the last quarter and further increased in this quarter, that ability for practices to take on and see urgent dental care patients is becoming more and more restricted. It is a very difficult situation and something that we are trying to work hard to address. But the dental contract that we have is very limited in its funding and inability to expand where the need is there.
So the outcome of the question that I just wanted some clarity on, because I'm sure other people have come across this as well, and I'll repeat it. If somebody rings a dentist or 2 or 3 dentists around where they live, coming out of area into a new area is a nightmare, and that needs to be addressed. I think in terms of any contracts for the future, that's something that's on your agenda, obviously. But after all, we're here for a service for the people out there that need it. And I still do understand, do I, Joe, that a person ringing a practice, 2 or 3 of them around Wakefield, say, you know, I have urgent need or whatever, the answer is not going to be, I'm sorry, we can't help you.
In some cases it can be, but ideally it shouldn't, Councillor Rhodes. Ideally that should not be the answer, but they just ringing just 2 or 3 practices may not be enough, you know.
Well, it's a sad state of affairs in these days that that's the case when we're looking at oral health and we want to move the picture, quite rightly, to prevention. And how can we do prevention when we can't get treatment in the first place to actually put somebody on the road to prevention? And I think there's a chicken and egg here that we somehow need to work together on. And I'm sure that's something that will come of that in the future. I think today, and I'm just looking at the time, and I know you're all very busy, and thank you very much for being here. I think today we've had an excellent presentation from quite a good team out there. You've seen the report from Health Watch. We could all associate with it, unfortunately. Excellent report. I'm sure you may have a point that you might want to have some comments on it at some time in the future with Healthwatch yourselves. It's a good exercise in communication, in knowing the real world out there. As bad as it is, you know, there's always something that we can try and do to work together. So members of the committee, what I'm suggesting today is that from today's meeting, it's been very useful, it's been very, very helpful. We've got some information today that I think gives us at least a good base for the future. I would want committee actually today to support this Healthwatch report in moving it forward as is asked in the report, to see where we can lead to some more investment or views that the team here has expressed today for the old health of the district. I want to thank you all for coming, and I know the one issue outstanding that you're going to get back to us was the central Wakefield and the points about the wards, etc. And we would be grateful to do that. I think what we'll do is, from the next session that we have, we'll see how we've moved on after today's meeting and how we can work together for the future. Thank you all for coming today. I really appreciate it, and let's hope that we're going to have some better investment, and hopefully that we will be seeing this picture of children with the state of the teeth that we're seeing them, and at the same time, if we can support the dental profession and yourselves locally in still continuing to actually let the government know how we feel about the situation of the state of our children's teeth, and indeed the message about sugar in products out there. At least that's one way we can do a good deed for our community. So thank you all for coming today. It's been a really excellent report. I do thank you. Okay, we'll finish that item now, and then we'll move on, if we may, to the next item on the paper, which in itself is another minefield for us to consider, and that is the issue about the white paper. 45 to 52 is your pages in your programme. As you'll see in that, the purpose of it is to set out from a scrutiny perspective the government's health and care on white paper. And you may wish to comment on the report. You'll see that on pages 53 to 70, it's providing members with details of the recently reported issues, and we want to know about the outcomes for health and social care providers across the district. We do know that in the white paper there are proposals going forward, as one has already been identified, that changes from, at the moment, the intermediate care services, the ICS, who are not on any statutory footing, who at the moment actually meet 4 times a year and are mainly they are mainly serviced by a committee underneath which is called SOGA. I reported on this before, that seems to be the way forward. It also mentions in the report about a proposition that the government may weaken the role of local scrutiny. That's yet to come to the fore in terms of further information. And at this time, I think in terms of the report, Andy's done an excellent report today. Andy, would you like to have some comments on it, please?
Thank you, Chair. Apologies, I've just been chucked out of my connection again, so I've just got back in, so apologies if I've missed anything. But in terms of the white paper, as you say, obviously there are implications for scrutiny, and that's the primary purpose of the paper today. Some members will recall way back in 2010, when the last white paper was introduced, the detailed level of consultation that took place at that time. I think what's quite evident this time is that there's been quite a paucity of consultation in relation to this white paper, and it is in part derived from ideas developed by and with NHS staff. And members will recall the very short consultation period that took place over the Christmas period into early January, and obviously resulted in the current white paper proposals. So at the outset, members may wish to make some comments in relation to the lack of public involvement in these proposals hitherto. As you was indicated, Chair, there are significant implications for scrutiny in the white paper, not least the removal of the power of referral, and the paper that's on the agenda today outlines some of the concerns in regard to that. Clearly, there's quite a shift of power in terms of the Secretary of State in terms of service reconfigurations, and one of the key benefits of local scrutiny in terms of service reconfiguration has been the way in which local members can use their knowledge and experience and involvement in terms of informing those reconfigurations. And there is a fear that some of that expertise and local knowledge, that street level knowledge, if you like, will be removed by these proposals being drawn up to the Secretary of State. And in that, I would say that the Secretary of State, him or herself, will find it difficult to come to an informed view on service reconfigurations without having that local knowledge and input. So clearly there are concerns in relation to that. And also in terms of the reconfiguration proposals, as the report indicates, it's very, very rarely used in terms of the power of referral and referral Secretary of State. Indeed, in this authority, it's only been used twice in the last 16 years, and that's reflected by and large up and down the country in terms of the frequency of these referrals. I think the other thing really is in terms of the ICS itself is the accountability issue. As you touched upon, Chair, in terms of the shadow arrangements, that seems to be now transposed into the white paper insofar that there'll be two distinct bodies. The NHS body that will be at the centre of the ISC, the decision-making body, and a much wider body in terms of the partnership. And again, there are clear concerns and issues around how the accountability sits with that split function, if you like. There is, in the white paper, a duty to collaborate with local authorities and the NHS. And again, it's not simply about duties. As we all know, it's about relationships and behaviours. And clearly there's a lack of detail in relation to that in the white paper. It's fair to say that there are some mature relationships within the Wakefield district and the West Yorkshire region in terms of partnership working, but nonetheless there are still concerns in relation to accountability. I'll not go any further, Chair, just to indicate that obviously this issue has been discussed at the West Yorkshire level at the Joint Overview and Scrutiny Committee, and indeed the Health and Wellbeing Board discussed it at their meeting last week. It's a question of whether members want to actually submit any comments direct to the Secretary of State or the Department of Health and Social Care, or whether or not they wish to pursue this matter through the JOSC arrangements, as they will be discussing it again at their next meeting in I think it's a couple of months' time. And indeed, the Health and Wellbeing Board have agreed to discuss it again in July when more detail will be available. Finally, I think what's important in relation to these white papers is the guidance that underpins it. Again, in 2010, the 2013 regulations put a lot of meat on the bones in terms of scrutiny guidance. And I think that's what's missing in relation to this white paper. So hopefully that detail will be forthcoming, but until it is, obviously there are a lot of questions remained unanswered. So in terms of the report, Chair, it's a question of whether this committee wants to comment directly on the proposals or through the JOSC arrangements.
Thank you, Andy. I see, Olivia, you want to comment?
Yes, I think Andy's said an awful lot that I would fully support. Can I just say, first of all, that I think we could do both, couldn't we? We could refer to the Secretary of State and we could respond more locally. I'm just concerned about this whole initiative at this time. I just think that, a bit like our previous discussion with the dentistry, things are being centralised to such a level that we have little input, and I think we've seen it so much with the administration associated with the virus, that things are done better locally, and yet it's being taken away from us. We will have little input or influence, and we have limited as it is, and I just do worry that in fact the Secretary of State will be doing his own thing or her own thing, and we will be ignored locally, and it's a real worry for the future of the health service. I also think it's a screen to just still ignore the fact that the health of elderly and people with disabilities is not being looked at, and it goes on, but without resolve. Thank you.
Kevin, you're next. Kevin, you've got a comment. Are you there? No, we've lost.
Sorry, I was slow in unmuting myself. I'm sorry.
Okay.
Yeah, echoing the comments both of Andy and of Olivia, particularly Olivia's comments about the centralisation, which I think is a bad move, even if there was very good accountability, which there isn't. So yes, go via the JOS scan, go direct. And I would comment that in relation to the power of referral. Now, as Andy said, it isn't used very often, but it's that long stop, the backstop power of referral, which is one of the things that actually means that health service organisations take us a bit more seriously than they might otherwise do, knowing that if they don't reach some degree of accommodation, then the likely outcome might well be, in serious cases, that there would be referral to Secretary of State. And I think that if that wasn't there, then I do think that health NHS organisations would pay less attention to us. Thanks, Chair.
Thank you, Kevin. Lynn, did I see you indicating you wanted to speak? Lynn?
Sorry, Betty. Sorry, Chair.
That's okay.
It's been addressed by both Olivia and Kevin. Actually, I totally agree with what they both put forward. So yeah, I think we need to support. Get behind this report and say we don't want it centralisation. We need to keep the scrutiny committees locally.
Chair, can I just indicate that if the government's minded to implement this legislation, that it may well be helpful to pick up on the suggestions made by the Centre of Governance and Scrutiny, in that if the Secretary of State does retain the power of referral, or gains the power of referral, should I say, that there should be some recognition that he or she would have to take into cognizance the views of local scrutiny committees in relation to the local reconfiguration. And what's happened in the past is, and you'll be aware of this, and long-standing members also, that when we looked at the Mid-Yorkshire reconfiguration, for example, which was a significant service reconfiguration, along with our colleagues in Kirklees, we were actually advised by the government not to refer too early. In fact, we were told that we should go the extra mile to actually seek a local resolution, and by and large, except for a few issues, we did that. And but we had to refer on the basis of what was still a contested issue of that reconfiguration. But we were actually doing what we were told to do in terms of finding local resolution. I think it's a bit disingenuous to actually suggest then that the reason why the Secretary of State wants this power is because local authorities refer late. They referred late because there was a real endeavour to try and resolve what were long-standing and complex local issues that were obviously better addressed by local people rather than the central government.
Yes, thanks, Andy. I do remember, because I'm part of that team, and we did go a long way in resolving issues locally. And as you say, you know, the local knowledge is always adds value to whatever the subject is. The other thing that really worries me about it is when it's centralised to the extent that we believe this is going to be, and reducing the knowledge locally to be part of a decision-making process, I worry and wonder about how much more parts of our NHS is going to be privatised. We've had some privatised by stealth already, And I do worry about the remoteness of accountability and the remoteness of local people knowing what's going on in terms of their health provision, where they live, their place. We hear all about their place, but suddenly their place is overtaken by a central role. What I would suggest today that we do, members, if you agree, is we've had some comments today from Olivia that we fully support. We've had some comments in terms of the issues in the white paper. If members would agree, I think what we can look at today as a starting point would be from the committee, from those comments that have been made today of our concerns regarding these proposals and the remoteness of the ability of local people to know what's going on for their health service, that we could actually just send off a letter to the Secretary of State on the points that have been raised today, and at the same time in the letter we could actually advise that we will again be revisiting this particular item later on in the year when more information is available to us, and that keeps it open for us as a committee to make our case and to be part of what is the process for the future. If you think, Andy, this is a good way forward, and members of the committee, could you let me know now that if you're silent, I think I will think that you've agreed with it. Is that a way forward, please? Okay, I take that silence as agreed. So we'll work together on a letter to the points of today, leaving it open for the future when more information is available to us out there. I think sometimes the powers that be forget whose National Health Service it is. It's the People's National Health Service, and we have to be part of the process, not the process being thrown at us in the way this is in this white paper. So let's leave it at that, and thank you for your involvement today. I do appreciate it. So with that now, we will move on, which is the Care Quality Commission's outcomes, again on page 950, on item 953 to 70. And you'll again see from the report today, when I first looked at the page, I thought, well, this is great. We've got so many goods today. And then, of course, we turn over and we've got 3 that require improvement, and we have 1 that's inadequate again. When you read through the reports, I think, again, it's disturbing to see some of the issues which we would value as being necessary to look after our elderly people in their care. I really am disappointed that we couldn't get the CQC here today, because here we are again with concerns that we have on these establishments. My concern as well is, when I've read the reports, and we've had a discussion about this, Andy and myself, when I've read the reports and you look at the deadline and dates, these inspections take place, and then it's maybe a couple of months later that the written report is actually sent out. So we have a situation, maybe, where the 6 months for improvement turns into 8 months. We have a situation where the 12 months, which is at the extension, may turn into 13 or 14 months. So all this time, the issue is about the change, the investment, the care, the attention that is needed. And that in itself is perpetuating the time that the people involved have to get together to sort out the issues about the care of our elderly. I know that it's something that we will come back to, because we are going to have the CQC here at the next meeting on the 22nd. What I would suggest is that on these reports, I can see, Martin, you've got a question, I'll bring you in. What I would suggest is that these reports here today, we've had today, we actually can use these as an example again. I've got other examples here in front of me, that we can actually use these examples again when the CQC come to put over our points of concerns. It's not going to go away. We are going to have a thorough review and investigation with the CQC on the way that they actually deal with situations such as we know about in these reports. Martin, I'll bring you in, love.
Yeah, thanks, Chair. It's just I know Craft House Care Home very well because my mum was in there with vascular dementia. I'm not surprised it's inadequate because upstairs is nursing care, downstairs is just care for people with maybe mobility issues, but upstairs is more vascular and dementia. And I'll give you one instance, Betty. I know they're not here to answer, but one instance, we were there as a family, and mum was in bed. A drink was cold in one of those cups, and the nurse went to get her a drink. And what did they do, Betty? They stuck the plastic container, like they have for feeding young babies, in a microwave, brought it back, and it burnt my mother's mouth because my mother didn't know where she was. She didn't know whether it was hot or cold she was drinking, and that's the type of issues that you were getting in that care home then. And it's absolutely frightening for some families, and more so for people that are in there that don't have a family to air their voice and their views. Thanks, Betty. Just have to say something.
Right, Olivia, I hadn't forgotten you, love. Only my box is rattling around here like mad. You wanted to come in with a comment, Olivia?
I really do. I mean, I accept fully that we're going to have a presentation from the CQC, but this is the third report we've had about Broxbourne House, which is in my ward. And it's presumably got 6-month intervals because we've had a number of them and we've indicated our concern. Meanwhile, as it goes on, these people who are resident in that home, if they're still surviving, they're surviving in awful circumstances. The report that we read last time was horrendous. Equally, Heathcote's, the situation there is that it's a residential home for people, I think, with learning difficulties. And what's happened recently is that I came across a man who said, I've been working there 6 months and I'm the longest serving member of staff. And what happens is that they walk out with the residents, 2 carers, and they walk around the area. And a new person on the app for the area in which I live has had his car broken at great expense, smashed by a resident. And last week, 3 other residents equally had their cars injured and damaged. And apparently that increases the insurance for the whole community. So there's quite a lot of upset about it. They've tried having some sort of discussion with Broxbourne. The police have been involved. The resident has done quite a lot of damage before and also broken windows. But it's basically, it may be something that they're doing and have no control over. But certainly the home itself is taking no responsibility for the wider community or the behaviour of this resident, and it's just simply not good enough. It's not obviously being run correctly, but also the fact that it's been inspected and requires improvement just concerns me even more. It's really, really appalling that we've got these establishments, somebody's making money out of them, and yet they're not treating the residents well, and in this case they're not treating the community well. Thank you.
Thanks. Yes, I am aware of the circumstances, and it's very distressing and worrying, not only for us to know that things should not be happening like this, but obviously the residents come first, and in where they live, it's their area, and in the majority of circumstances, residential homes and the residents and staff are welcome. But what isn't welcome are situations where we feel, and through these reports, that the residents could and should be better cared for. So we will be bringing all these back up again, and it's not going to go away, believe me, on the 22nd. It's going to be the first item on the agenda, and we will make sure that we have a system in place where we've got the CQC able to be here to listen to our concerns and to speak to these reports. So what I would suggest today is that we again raise our concerns about the reports that we've had of inadequate, etc., and we bring these back to our meeting on the 22nd, on top of the others that I've got here ready, to get some questions and some answers, we hope, from the CQC. So if you would agree with that today, then that will be top of the agenda for our meeting on the 22nd. And yes, we will do all that we can to bring to light what we believe are inadequate services for our most vulnerable people in our community. We really will. So if you agree with that, we'll bring these reports back on the 22nd, and it'll be the first item on the agenda. Is that okay, everybody?
Agreed, Chair.
Thank you very much. That's great. Now then, the very last one is the forward plan of key decisions. The report obviously identified 3 areas for us. Well, it's 2 really, because they've combined one. Stop Smoking Specialist Service, and then there's a contract extension for the provision of Children's Health Service. That's the Health Visiting School Nursing and Family Nurse Partnership. I have to say that when I see this on the forward plan again, I do have to wonder what over all the years that this has been brought forward on the agenda in terms of the health of our district, what we've actually achieved. As far as I can remember, going back 10 or 12 years, this has been around, and I do hope when we get to look at these, obviously they'll have to go in a priority area with everything else that we're dealing with, but I really would like to know from this service, when we get round to it, to know what improvements has there been in the health of the district to the smoking cessation issue, and we really do need to be looking back and saying, well, what are the outcomes and what can we do to add value to them? So those are the things we'll be putting on the agenda, please God, for next year, and hopefully we will get the CQC here. It should be a good meeting. So if you agree with that, we'll put them on the forward. We'll put them on our list of areas to cover for the next municipal year. If that's agreed, then what we'll do is go on to item 11. And as I've already mentioned, we've got the next scrutiny committee on the 22nd of April 2021. We'll look closely at the agenda again to make sure that we've got sufficient time to give to the CQC. It was today extra time that was added to the dentistry report, which in itself I think we all valued. So with that, can I declare the meeting closed, and thank you all for your attendance, and I hope you found the dentistry one, which I certainly did, of great value today. Thank you all, and safe journey home. Keep safe.